ADHD, Attention Deficit Hyperactivity Disorder, is among the most common mental health conditions affecting children in Canada. So far, however, it's not a diagnosis that automatically triggers additional supports in Ontario classrooms. Some parents and advocates are hoping to change that starting this election cycle. Joining us now for more, in Calgary, Alberta, Dr. Ainsley Gray. She's Medical Director of the Toronto-based Springboard Clinic. And here in our studio, Heidi Bernhardt, President, Executive Director of CADAC, that is the Centre for ADHD Awareness Canada, and Natalie Waddell, a Waterloo Region District School Board Trustee. And we are delighted to welcome you two here in our studio. Dr. Gray, nice to have you on the line from Calgary, Alberta. And I'll start out west with you with a definition of ADHD. If a child has it, how does that manifest itself?
Well, thank you for giving me this opportunity. ADHD is initials for Attention Deficit Hyperactivity Disorder. But really, it's not always accompanied by hyperactivity. It may be impulsivity and inattention without a lot of physical restlessness. So it will present itself in either of those two diagnoses. But the common age to pick up a ADHD child is between the ages of 5 and 8, depending on their presenting symptoms.
And do we know what causes it?
We know it has a very strong genetic tendency, but there are also epigenetic or environmental factors that will make clusters of families as well as individuals more susceptible to being diagnosed.
Give me an example of that. What's something in the environment that could cause someone to contract ADHD?
Well, sometimes prematurity, sometimes prenatal exposure to alcohol can influence an individual's ability to focus and stay engaged.
And how common would a misdiagnosis of ADHD be?
Oh, it can be very commonly misdiagnosed because it's so often comorbid with other indications like anxiety, school difficulties, sadness, or mood disorders.
Okay, let's do one more before I get the other two in here, and that is, just so I'm clear, you said it's genetic, so if a parent's got it, chances are the kid will get it too? Is that the idea?
The chances are very much so, and most importantly, screening in both directions. If a child is diagnosed, what's going on with mom and dad or other siblings? Or if parents have it, they need to be on alert for their offspring.
Okay, Heidi Bernhardt, this is not an academic discussion for you. Have I got this right? Your husband has ADHD? 3 of your sons have ADHD?
Yes, all 3 of my sons.
All
yes.
3 of your sons have ADHD. What is your life like?
Well, they're all grown. They're all out of the house. We've been there, done that. I also have a background in psychiatric nursing, so it obviously led me into my passion of what I do, and CADAC. I founded CADAC. So my life right now is hectic with work and hectic actually with looking after senior citizens, but the boys are all out of the house.
Okay, but when you were a young mother trying to raise 3 ADHD children.
The biggest difficulty was we're talking 25 years ago, so we did not know then what we know about ADHD now. Hence, there were no resources, no support for families, no education for caregivers, and why I founded CADAC.
Did they even know that that's what it was when it happened 25 years ago?
It took to the age of 14 to diagnose my oldest child because all 3 of my boys are gifted as well, right? So they weren't failing school. So and they weren't extremely hyperactive, so all those red flags didn't go on. So it took quite a while to figure out what was going on, but when we did, then we could move towards proper treatment, putting in plans, parenting plans or plans in the household, and things got much better.
If they weren't manifesting significant hyperactivity all the time, how do you know that's what they had?
Well, the attention, the emotional regulation, which is another core part of ADHD that not many people know about, right? So there's an awful lot of symptoms besides attention dysregulation, hyperactivity and impulsivity. It's a very complex disorder, and most people don't know that.
Let's get to Natalie's example then. Your experience starts with your son, I guess, who's in grade 6 now?
Yes, he was in grade 6.
Okay, diagnosed with ADHD when?
When he was 9.
So a couple years ago?
So, yes, just, yeah.
What was, walk us through the process of trying to, I guess, understand the symptoms that he was presenting and then get a diagnosis for what everybody thought it might be.
Right, so it was a journey that we started back probably in grade 3, because we really recognized at that point the differences kind of shook out. The other kids were getting farther ahead in, self-regulation, organization, all those sorts of things that kids often struggle with. So in grade 3, we started looking at, there may be something a little more than just the behavior issue that he was demonstrating at school.
And the behavior issue meant what?
Speaking out.
Acting up in class, that
acting
kind of
up
thing?
in class, not sitting in his seat, being very loud. It could be pushing kids on the playground because he's frustrated, and he doesn't. At that point, he didn't know how to regulate himself, and we didn't know that that's what was going on.
Okay, don't take this the wrong way, but back in the day, all that stuff happened when I went to school too, but nobody had a name for it. We just thought it was sort of bad behavior. How do we know this is actually ADHD?
So my son, we ended up getting my son tested through a psychologist, a psychoeducational assessment, and then he also was tested through a pediatrician. And all signs came back that he did have ADHD because of all the markers that were kind of flagged during the testing.
Checked a lot of boxes.
Checked a lot of boxes.
Okay, so you've got the diagnosis, then what do you do?
So then we presented to the school, and this was just prior to grade 4.
It's in Waterloo?
In Waterloo region, yes.
Yes,
So we
okay.
present it to the school. We get things into place. He also has a learning disability, so that automatically qualified him for special education, like special education equipment. So he has a laptop with assistive technology on the laptop.
But just to be clear, the additional supports that you would need as an ADHD student, he did or didn't get?
He did get them indirectly. So just because he had ADHD does not mean that that student will automatically get the supports. It's really on a case-by-case basis, is the child impaired and are they impaired enough?
And I guess that's the point, right? Once the diagnosis of ADHD kicks in, there isn't automatically additional support that happens.
Yeah. Right.
And that's what you want to change.
It's the learning disability that triggers the support, because the learning disabilities and autism, which are both neurodevelopmental disorders, are under the categories of special education in Ontario. ADHD is not. So if a student has a learning disability or autism as well as ADHD, they will get support.
I got the list here. Let's go through this. Okay, Sheldon, we're at the top of page 3. Why don't we bring this graphic up here? Because, here's one of these wonderful acronyms that the Ministry of Education likes to use. When your student is identified by an IPRC, Identification, Placement, and Review Committee, okay, once you've gone through that process, there are all sorts of exceptionalities, as I gather they're called, which entitles you to additional help. And you can see them on the list there. We got behavior, autism, deaf or hard of hearing, language impairment, speech impairment, learning disability, giftedness, and so on. I mean, we go all the way through here. Dr. Gray, let me get your view on this. Do you think that ADHD ought to be on that list as well, and therefore students automatically should be entitled to additional supports if they're so diagnosed?
Yes, I strongly think that if it's identified early, because it responds so well to treatment, the younger the child or adolescent is in being picked up, makes it extremely important to flag these individuals, whether they have a comorbidity like a learning disability as well. Let me give you an example that has changed in the last 5 years. In the post-secondary age group, often universities would not consider accommodations for students unless they had a full psychoeducational assessment, which Heidi referred to as being one of the parameters in identifying a learning disability. but ADHD by itself would not achieve the required strategy change. After a number of very serious mental health tragedies, the post-secondary colleges and universities now treat ADHD as a standalone in order to access accommodations.
And you would like to say the same thing happening, I gather, for secondary and elementary students as well?
Absolutely. And accommodations are not, what I mean by that term is perhaps extended time for exams, perhaps use of other resources, but it's not an excuse for people to not perform to their ability. It actually levels the playing field for students so that they can optimize their learning opportunities.
Natalie, you put forward a resolution recently to the Waterloo District School Board, yes? About this? What was that about?
So it was a proposed resolution. I had to put it forward to my board to get their support, and for it to go forward to the Ontario Public School Board Association. But it basically is to get, ultimately I would like to have the Public School Board Association lobby the Ontario Ministry of Education to include ADHD and other neurodevelopmental disorders in a category. And then another important piece would be to have the ministry invest in educating the educators.
Okay, yes. Two different things there. First one first. You put the resolution to the Waterloo Board.
Yes.
Did it get through?
Yes, it did.
So it's going to the Ontario Public School Boards Association now?
It went to their executive council, and my
what happened?
Understanding is that it will go to the annual general meeting at the end of this month.
At the end of this month, at which time they will vote on it?
Yes.
And do you have any sense about how that vote's going to go?
I have no idea.
You don't know?
No.
But if you get a yes vote, it goes to the Ministry of Education and presumably begins to pressure them for a positive verdict.
Yes, that's my hope.
That's your hope. Okay. What do you think the chances are of that happening? You know the system.
Hi, do you know what? We've been advocating for this for about 15 years now. We've had numerous meetings with the Ministry of Education.
What's the argument against doing it?
You know what? There's a lot of rhetoric around it. There's a memorandum that was sort of a hard-fought battle to get, that was published in December 2011, that said students with ADHD should not be barred from being IPRC'd. But then the school board...
Oh boy, that's a verb. Hang on. That's a participle.
Yeah,
IPRC'd means what?
Okay, identified under the Identification Placement Review Committee, okay? So actually getting that identification as being an exceptional student who has the right for special education resources, right?
Okay.
So this memorandum says you shouldn't bar students with ADHD, but the school boards, many of them are still saying, but look at the definitions of those categories. ADHD does not fit into one of those definitions, so too bad, so sad, we don't have to identify these students. Yet the Ontario Human Rights Commission identifies ADHD as a disability, and in my discussions with them, they have shared that, yes, these categories are an issue because they have no input into that. And it's these categories that are the stumbling block. And the ministry kind of says, well, you know, school boards can use any category they want. In reality, they're not.
They're not, because they've got this list here and it's not on the list, so you're out of luck.
Exactly.
Can I guess? Yeah, Dr. Gray, jump in, please.
Just jump in for a moment. The other complicating thing that Heidi is very familiar with is that because of the stigma and myths around a mental health diagnosis, which includes ADHD, the parents often do not reach out and involve the school or communities for support because of all the misunderstanding around exceptionality. So I think empowering parents, in this case, to recognize that the school is a source of support is a very big hurdle that has changed in the last few years.
Well, Trustee Waddell, I don't know this for sure, but I'm going to take a wild stab at it here. My hunch is that the ministry doesn't want to give you this because it'll cost them tens, if not hundreds of millions of dollars to provide these extra supports to students, and they may not have the money. Or they may say they don't have the money.
I think that might be a fear of the provincial government, but in reality, the accommodations that we're talking about are not generally things that cost a lot or anything at all. It might be preferential seating for a student that's easily distracted. Don't sit them near the hallway. It might be giving instructions in a verbal way as well as a written way for the ones that learn and retain the information differently. It's chunking out project work with a little checklist so that they can move through the project without getting distracted.
Well, none of that sounds like it costs anything. So why, again, would there be a reticence to green lighting it?
I think some of it is, well, not for green lighting. I think some of it could be done, and it would help other students, not just the ADHD students. And it's a lack of education, a true understanding of what ADHD is.
Yeah. Our message to the educators is, if you don't identify these children, they don't just disappear in your classroom. So they are still being disruptive. They are not getting their work done. You're sending them down to the principal's office. You're having to deal with assignments not handed in. So you are expending your resources in ways that you're being reactive. Why don't we be proactive, educate these educators to understand these kids and not look at them as lazy or bad kids, which they do frequently, and put in those strategies, those classroom strategies, as Natalie said, who are they're beneficial to the entire class, but they're essential for kids with ADHD.
It sounds like a classic upstream, downstream problem.
Exactly.
Solve the problem upstream.
Exactly.
So that by the time they get downstream, they're not a bigger problem. Dr. Gray, go ahead.
You know, you can't help but feel passionate about this because somewhere between 60 and 70% of these children who are identified will not grow out of their ADHD diagnosis. The signs and symptoms will change with maturity, but the cost of impairment to society is massive. And by allowing children to develop strategies and the ADHD to be treated, once it's identified, it's so responsive to intervention. And I think being proactive is going to save society in the long run.
Can I get you to follow up, Dr. Gray, on this aspect of it? I hear from time to time that there are still plenty of medical professionals who are kind of unwilling to acknowledge ADHD as a serious mental health issue or condition. Do you hear that too?
I certainly do. I'm a general practitioner, and I focused my practice on mental health and primarily school-based issues back in '94. And over the 25 years, there have been huge advances and changes, and ADHD diagnosis is real. And the apprehension, I think, often of primary care physicians is a comfort level in understanding it and how they can support it with the medical side of perhaps pharmaceutical intervention without running into the diversion, apprehension, and fears around the medications that are often used.
Natalie, I do not want to invade your family's privacy here on television, but you are here, and you know, I'm going to ask you a question. If you don't want to answer it, that's okay.
Okay. Once
you discovered you had to deal with your son's ADHD, did you put him on meds?
Yes,
I did. How did that go?
It was fine for a little while, probably 6 months, and then he had an extreme adverse reaction to the medication.
How did that manifest itself?
He started saying, "What if I hurt myself? What if I hurt you?" That sort of thing. So there was some suicidal ideation signs. So we took him off, and I think the reason that we ended up down that path was the medical profession that we had was not totally understanding the medication, not totally following up with us on a regular basis.
And your son is or is not on meds now?
He was off for quite a period of time because we were very scared to put him back on. He was 10 years old when that was going on, and it was extremely difficult for our family. So we tried a different type of drug very slowly. We were fortunate enough, because of the way he had the reaction to the medication, we were able to get to see a child psychiatrist who is now managing his medication very well.
And how's he doing now?
Oh, he's doing wonderful now.
Isn't that great?
Yes.
Isn't that great?
Yes.
What do you think turned the corner?
So I think there's a few things. So he's maturing, so that helps. The medication control is definitely helpful. The third thing that I would say is significant was a change in a school. So we had a boundary change, so he was fortunate enough to go off to a new school. And I think the educators at the new school, for whatever reason, they have a better understanding of ADHD, how to accommodate children like my son.
Good.
And it's been a wonderful experience for him.
Just curious, if this is genetic, did you test yourself?
So I actually went to Heidi's conference in the fall last year, and I kept hearing about parents raising kids with ADHD and how difficult it can be, and that 76% of children with ADHD have a parent with ADHD. And that made me start to think, and I ultimately did go get diagnosed a couple days past my 50th birthday. So it was a real aha moment, because I understand now a lot about how my mind works. And
well, what was the verdict when you got diagnosed? Like, you've got it?
I have ADHD, yes.
You've got it too?
Yes.
Okay.
Yes.
You buried the lead there. I didn't know that.
Oh, sorry.
Dr. Gray, go ahead.
I would just love to jump in here, because when I opened Springboard Clinic in Toronto in 2009, taking a look at lifespan ADHD a diagnosis, we expected the majority of patients to be children. But in reality, over half of our assessments now are adults, and generally above average intelligence, and often university educated or university students. So a very important myth to dispel is that because you have a university degree or a professional education, you couldn't possibly have ADHD. Well, that's wrong. The hyper-focused type of support that many people with ADHD can turn on shows how unique and marvelous our brain can be. And having ADHD does not have to be seen as a huge liability when treatment options are employed.
Heidi, can we look at the flip side of this for a second, which is I imagine there are parents out there as well who get the word from their kid's teacher that, you might want to look into having your kid diagnosed for ADHD because
No, they can never say that. They can say, here are the signs, the symptoms we're seeing, or problems in the classroom. You may want to go to an assessment. An educator can never say.
Can never use the words.
No.
Okay.
No.
But I guess what I was getting at here was, are there parents out? I imagine there are. You can tell me how frequent an issue this is. There are parents who say, no, my kid doesn't have it, because they are afraid of the kind of stigma that comes associated with that diagnosis.
Well, and the stigma around ADHD and the misinformation in the media and the general public is huge. So yes, we get a lot of the backlash. My child is not one of those kids, and no way, no how, and he's just a chip off the old block, which may be very true, right? There's nothing wrong with my son or my daughter. And the stigma causes so many issues, and actually is at the heart, I think, of why schools have not really done anything about ADHD, or the government doesn't understand how it impacts the justice system, the workforce, everything, because parents and families of ADHD still buy into that stigma. They don't talk about their child having ADHD or themselves having ADHD because they're afraid of being labeled a bad parent. When we do our advocacy work and talk to politicians, they say families never talk to us about ADHD, but parents of kids with autism do. Our message to parents is they have to get out there. They need to talk to their elected officials that, yes, this is an issue for them, and it's of interest, and they want the government to do something.
We will see if this becomes a bigger issue on the election campaign hustings, which we're in the midst of right now. I want to thank Dr. Ainsley Gray, the medical director of the Springboard Clinic, for being there for us in Calgary, Alberta for us. We appreciate your participation, Dr. Gray, very much. Thank you.
Thank you very much.
And here in our studio, Heidi Bernhardt, President and Executive Director of the Centre for ADHD Awareness in Canada, CADAC for short, and Natalie Waddell, the Waterloo Region District School Board Trustee. Thanks so much to the two of you as well.
Thank you.
Thank you very much. Have a good day.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.